So next is needle stick injury V29. You're sitting in theater coffee room when you get called to say that your ST5 has just had a needle stick injury. He was operating on a previous IV drug user. What do you do? So first of all, I will go and check what happened. Was that needle cleaned, or was it a bleed? Had it already been used during the operation? I will advise him to encourage the bleeding. Wash with soap or chlorhexidine. Do not scrub and suck the wound. And send the ST5 to occupational health. If not out of hours, then ST5 to the emergency department and contact the on-call microbiology consultant for advice. Complete risk assessment of the source patient as detailed in local guidelines. And once source is fully conscious and has capacity, check the consent for and obtain sample for testing of hepatitis B, C, and HIV. Report the incidents via local guidelines and report to Health Protection Agency. What will occupational health do? They will take blood for storage, and they will check whether he needs hepatitis B booster, and they will counsel him regarding risks of seroconversion, risks in this incident, safe sex, no work restriction, HIV, HCV, HBV follow-up blood test. What are the risks of seroconversion? So 0.3% for percutaneous needle stick injury from HIV infected patient, 0.1% mucocutaneous contamination from HIV infected patient, and 0.5 to 1.8% percutaneous needle stick from HCV infected patient, and 30% for non-immune individual percutaneous needle stick from hepatitis B E antigen positive patient. HBeAg positive patient. What body fluids can transmit blood-borne viruses? Every fluid from head to toe: blood, saliva, CSF, petroleum fluid, pleural fluid, vaginal fluid, semen, breast milk, amniotic fluid, and synovial fluid. So starting from the top to bottom, the anesthetic FTU was helpfully taken blood from the patient while he was still asleep. What do you test it for? It has to be discarded. Blood can only be taken from the source with his consent. There must be a pre-test discussion prior to HIV testing. Same test as done for the blood donors. Confidentiality and decision to take blood not based on perceived risk of positive result. Patient can decline blood not to be taken by the exposed member of the staff. How do you prevent needle stick injuries? So surgery should be performed by the experienced staff and experienced scrub nurse. Universal standard precautions: no touch technique for blades and needles should be passed in the kidney dish. Never resheath a needle, and safety shielded venous and arterial cannulae, and safe disposal of the shafts. If the patient was known to have HIV, what extra measures should your SPR take? So post-exposure prophylaxis should start within 1 hour of the injury, and 28 days of antiviral drugs, and may need time off work due to drug side effects, and can be started these medicines within 72 hours of square but less effective. Thank you.